Hello, everyone. Welcome to HT Dialogues. On the occasion of World Mental Health Day, today we have with us eminent guests Dr. Sameer Parekh, Director, Department of Mental Health and Behavioral Sciences, Fortis Healthcare, and Chandrika Iyer. She's a counselor and parent coach to talk on mental health driving positive change. Welcome, both of you, to HT Dialogues. Why we are doing this is because 10th of October is World Mental Health Day, and we are trying our best to raise awareness because still we feel that mental health has not gotten its due. So, with both the guests, I would like to give you some time to talk about it individually. Do you think how important is mental health care? Do you think right now, at this point in 2023, how important is it? Are we giving it the due it requires? Please, Dr. Parekh, let's start with you.
I mean, you define health without mental health and you won't be able to reach any place, right? That's a fact. You look around yourself and look at the healthcare providers of the country and how many of them have a well integrated established mental health program. You look at workplaces, how many of them are giving you end to end mental health solutions, given that there is a concern both with access and affordability. Look at the fact as in terms of schools, and you look at the number of schools that are in the country and you add it with the number of counselors that are in the school and just figure out which number is more and which is less, right? You look at the rapid changes in our environment, look at the sheer prevalence of mental ailments in the world. You look at the fact that even today, more than 70% of people do not seek help primarily because there is stigma in the world. So, just because on your social media feed you get a few more posts on mental health, that does not change the fact that mental health is not even remotely the kind of place or priority that it should be.
Thank you so much, Dr. Parekh. I think what you said makes so much sense. Coming to you, Chandrika, do you also think that mental health has not gotten its due? I mean, the sense that we got from Dr. Parekh's response is that we're still lacking. So, do you think you agree to that, or do you have more inputs to add to that?
No, certainly, the figures are pretty abysmal when you look at the statistics. But I have seen, especially post-COVID, more inclination from people to seek professional help with respect to their mental and emotional well-being. And, also because there's been quite a bit of awareness that has spread through podcasts, YouTube videos, TED Talks, a lot of celebrities talking about their mental health challenges. So, the awareness has definitely improved. And in my own practice, also, I find that, especially parents are more willing to recognize signs of distress in their children. And teenagers themselves are able to recognize when they have emotional, health problem or a peer problem or a conflict problem, and they're more willing to seek help. But having said that, I completely hear what Dr. Parekh is saying. We have a really long way to go, and it is a multi-pronged approach. Just because a child comes for therapy, we don't have a quick fix solution. It's not a magic wand process. There is the social circumstances, family circumstances. Everybody has to pitch in. It's the responsibility of every individual, who is going to contribute to the well-being of the child or the individual. So yes, there is a lot more that can be done, especially in the education sector. It is, I think it's so imperative that we provide social and emotional learning and make it an integral part of the curriculum. And also, not just make it one day in the year, or give one workshop in the year in a school. That's not what we are talking about. This has to be a movement. The awareness, and that's the only way. The more you talk about it, the stigma that we're talking about. I mean, how comfortable would you be to tell when you go to a party and tell an acquaintance, I seeing a psychiatrist versus I'm seeing a cardiologist. So the stigma is very much still there, but I think I would think that yes, it's work in progress, and a lot needs to be done. But I think with the right impetus, we can start to make more changes in the future.
Dr. Parekh, one thing that stayed with me was this word stigma. So this was something, I mean, I have known you personally for almost a decade and a half now. This was something that we talked about then, and this is something we are talking about now. So do you think is there a solution that you see for this? How we can combat this word stigma? We have had Mental Health Care Act also passed recently. So I think that has helped in any way?
Look at from where stigma comes. Stigma comes from any form of social communication that a person is observing. So, from films to OTT to media to books to advertisements to just conversation on social to what you hear in your immediate environment to comments to reactions, all of that takes its own toll. Now if you even look at the top reasons why people do not seek help even when they realize they are struggling from a mental health concern which where they can be helped, one of the reason being that they feel they will be discriminated against. They feel they will be blamed. They also sometimes do not know where to go. And a lot of times they don't have access. Now, the access part has now become better. I think our government has done tremendous job in promoting and developing telemental health, and I think it's a remarkable effort. Yes, COVID triggered it, but then that's life. Life gives you moments to learn, and we all learned. And I do
Yeah, I
feel
think
telemental health
Manas is working really well. Yeah.
it's a tremendous effort. I mean, let's accept it. It's a tremendous effort, and that is also a solution. Why? Because in your metros, urban metros, the number of experts available is very high as compared once you start going further away, tier one, tier two, tier three,
Rural
district,
areas.
rural areas. So yes, tele does bring access. It brings affordability both. So that having said that, we've put in a lot of effort, a consistent lot of effort, and be very clear when we and understand the difference here also in terms of mental health and mental illness treatment. Now we also need to understand both have a role to play.
Yeah.
So you don't only talk about lifestyle when you talk about, let's say, diabetes, you also talk about early intervention, medications, treatment, and so on and so forth as well. This is not going to replace this, and vice versa. They go hand in hand.
Chandrika, I would just like to talk to you here about you deal with parents, you deal with children, younger people. So, do you think there the intervention or they're more open to seeking therapy or seeking help per se, not exactly therapy, because initially you do not really realize that there's something wrong. I mean, in a big way, you get those signals that there's something amiss. So when that happens, do you think they are more open about talking to counselors? They're more open about talking to seeking help, basically in general. Do you think youngsters are more open to?
Oh, like Dr. Barak was saying, not everybody, people may realize that they are not okay, but it's not everybody who's going to go and seek help. And when it comes to the parent community, I mean, I would think that most parents are well-meaning and well-intentioned, but uh, parenting the Gen Z, what we call digital natives, has brings its own challenges. So yeah, it's hard work, and I think parents need a lot of support here. And in the parent workshops that I take. I do, it does make a difference, especially teaching them certain skills like, communication or, even teaching them mindfulness skills. It goes a long way in resolving, the challenges they face, with their children. And it has to be a concerted kind of effort. Nothing can happen in isolation. But I would think that a lot of work can be done with the family unit, because parents are the primary caregivers, and emotional self-regulation needs to start from there. And if we can teach parents some of these skills, I think, I have seen that it really really is very impactful when it comes to dealing with their children. So a lot can be done for sure, but I think having support groups is so important in this field.
Chandrika, I would like to interrupt you here a bit. You talked about support group. So one thing, do you think the younger lot is more vulnerable these days? Because we have seen back in the day, we used to have joint families. So the support system used to be really strong. Now we are moving more towards nuclear families, especially in the urban areas. So do you think that has had an impact, and we need to solve that? Basically look at a solution there from that perspective. Is that important also?
It's become challenging because there is this very blurry lines that children have between the virtual world and the real world. Technology is an integral part of their lives, but they a lot of parents who come to me have this constant lament that children are spending way too much time on their gadgets, and sort of there's a kind of a sense of social atrophy here. There's not too much of a social connection. And this is where, when I say we need to support parents, we need to sort of help them understand, and help them draw these boundaries. Before you give a phone to a child, have these certain kind of rules or guidelines, instead of waking up 2 years or 3 years later and finding out that the child has doing going on too much of online activity. So when you sort of empower parents with the right tools, and I think we can mitigate some of these challenges that we face.
Dr. Parekh, picking up from there where Chandrika left, you have been running these programs, young mental health advocacy programs, for a very long time in Fortis now. So, and you have these youngsters who are they're like sort of peer educators, or does it help really to pick up red flags when you have somebody who's, if not an expert, but at least trained in a certain way to pick up these problems, little issues within their peer group? So does that help? Has it made any difference? What would you say?
So you'll have to split this in various parts, to be honest. Let me try and give you a spectrum here of how and where this helps. Let's start from school, and you have mental health curriculum as an integrated part of education. We've written a mental health curriculum which now being picked up by several schools both here and overseas. It's a curriculum, which means you train teachers, help them understand certain aspects, which is stigma, the narrative, what is mental health, what is mental illness, identifying, creating building resilience, and creating a well-being atmosphere in the classroom. That's one part. Second, you add media literacy and consistently work on media literacy. Why? Because media is going to become a lot worse than what it is right now. Right, this is not the best. Then you add the psychological first aid component. WHO has been talking about it for a very long time, which means you train people on psychological first aid. The look, listen, link, meaning you understand what are red flags, see what basic support you can give at your level, and then link them to a solution. The problem could be academic, performance related, peer related, bully related, or it could be a mental health concern where talking to a counselor, psychologist, psychiatrist may be required. So link that. That's a psychological first aid, right? And you add one part, which now WHO has been talking about, the 2022 report, working on bullying in schools and making schools bully free, because bullying has been identified as a significant concern in adult life also for mental health concerns. One part of it. Second part, you work with peers. Now we've been doing, like you're aware, the peer moderator workshops, and we've been doing that. So what we do is we create peer role models, peer who know how to identify and how to also do the basic intervention, and parallel do awareness and education. So we work on aggression studies, exams, risk behavior, gender sensitization, so on and so forth. Then comes this third part that you were talking about. You've been a mentor to our advocates, which is young mental health advocacy. Now these are young kids who use social media to create awareness, given that a lot of young people are on social media, and because they are uh, exposed to all sorts of narrative, and sometimes they may not be able to filter which source is how credible or not. So it's important that young people themselves understand and learn what advocacy is to be able to impact life. Now, this is the spectrum we need to look at.
So one thing that Chandrika, I would like to ask you is what kind of cases do you see? I mean, now, and if we just go back, rewind a bit, and see like 5 years back or 10 years back, what's the difference? What are the kind of complaints you usually handle?
A lot to do with bullying, mostly cyberbullying,
And now you're
and
saying that now the more cases
now,
of cyberbullying.
more, yeah,
Mm.
more than what was prevalent let's say 5 years ago. And I somehow I feel it is sort of increased post COVID.
Mm.
And the usual, some things that have remained constant is, peer pressure, academic pressure, and then of course the parent child conflicts that are there, and a lot of the time, in the communication is not okay between the parent and the child, and that further leads for feelings of isolation and distress. So currently, I think, a lot of children come to me because of the bullying, mostly cyberbullying, and also because of a lot of academic pressure. When children move from grade 10 to, let's say, to the IB curriculum or the AS curriculum, there is that significant increase in the academic pressure, and they're not able to cope. So,
Mm.
so the lack of emotional resilience is one factor, that, and then, a lot of unrealistic expectations from the parents. So all of this is sort of continues to be there.
Dr. Parikh, I would like to ask you, you mentioned depression. So, but we often what we do is very loosely we say, oh, we are depressed. But in we're talking about clinical depression, which is an entirely different diagnosis altogether. So how many of those who come to you, I mean, especially seeking therapy, I'm talking about, who think that they are probably depressed or anxious, do actually need it? That is another aspect that I would want to touch upon, because sitting at home, probably you think you are depressed, but when you go to a doctor, whether it's clinical depression or not, so how many of such cases do you find where people just needed to probably do something, divert their attention or do something light, not really seek therapy because it was not required? How many such cases do you see?
No, I mean that the honest answer is that the number of people who are not seeking help is so overwhelmingly high
Hi.
compared to a minuscule, if at all any, who are seeking just because it's woke or something like that. And that's actually not true. That's also a myth. It's
Hmm.
just one of the it's one more stigma that's been
Hmm.
added because of the nature of communication and social media interface that we have. But that's
Yeah, in a
actually
sort
not.
of reverse stigma, saying, oh, you do not need
And
help, or probably I need
let's
overdoing it.
let's say you go to a cardiologist and you say that I feel I'm having blood pressure. The cardiologist checks you and says you have nothing, chill.
Hmm.
That's the worst case scenario, right?
Hmm. Hmm.
So you'd much rather have that happening than when you have a cardiac problem and you don't go, thinking
Hmm.
what will people say? So let me not go. No, it'll get fine. Let me try and do it by myself, and it'll be okay. So that's not the case. When it
Hmm.
comes to loose talks, I agree. I think language plays a significant part. Even today, I don't think, for example, media's reportage around suicide is following the guidelines that are given by WHO. I mean, even today, prominent media houses also end up making the errors when it comes to death by suicide. We still use words like commit and not death by suicide. We still end up talking about the nature, the method, the note, and I mean, all these are all errors. At the same
I can
time,
say
people,
with confidence HT doesn't. We at
yes,
HT do
and
follow the guidelines. Yeah.
mentioning the
So the team,
mentioning helplines, and no, you're right. But the fact is,
the
all of
awareness needs to be.
this is happening, right? So similarly, what also happens is that when you are looking at, I mean, so you will hear people saying, oh, I am depressed, or oh, I have OC, or oh, I have this. Not these only create more feeling of insensitivity.
Mhm.
This is also one version where you are diluting something. Depression is a significant medical illness. Anxiety disorders and depression put together, just these two illnesses together, do, for those who come from workplaces, you lose more than several billion days a year to productivity, and the annual loss is in the range of $1 trillion. That's the impact. So please, we all need to understand, when we say depression, it's an illness, structured, standardized diagnosis, followed by evidence based treatment. No matter where you are in the world, it's going to be the same. But if you don't start treatment early enough and it becomes more than what it should have been, that's when the morbidity, the disability aspect becomes so much more.
Another thing that I would like to ask both of you is about substance abuse. That is another problem that I think goes hand in hand. So, do you think that is still a big problem for us when we're talking about in the field of mental health care?
It is. It is, and it's becoming younger day by day, and that's what bothers me more than anything else. The nature of social media conversations, or social conversations, use of substances by peers, display of substances in a glamorous way in entertainment media. All of these things have a role to play. And frankly, more important than that, right now, if you ask me, one of the reasons why substance abuse is becoming even a bigger problem is because of the sheer fake and rubbish information available online, where you will have hundreds and hundreds of links which will be glorifying, glamorizing, or defending substance abuse, which is unacceptable, but it is what it is. You can't control
Or
what people.
maybe a lot of youngsters use this as a way to, it's an outlet probably to give vent to their feelings when they feel stressed. So probably this is what they go to as last resort. That's still common, is it?
They may be doing it because they've been falsely informed or falsely led to believe that any de-stressing happens on substances. Biologically, that is incorrect, because substance use increases chances of depression, anxiety disorders, amotivation, neurocognitive concerns, insomnia, and certain substances have a correlation with psychosis as well. So this whole narrative created that substance abuse may be either helping us relax or sleep or bring out creativity and this and that is all rubbish. Anybody listening to this, learn to filter the nonsense from the fact. It is your life, your body, and if you take a substance in, it's only going to harm you.
Absolutely. Chandrika, what do you have to say to that? Do you also deal with this kind of problem where you have to really explain to people around you who come seeking help that, this is not working, this will not work in the long term? Do you also deal with this problem a lot?
Some of my clients come to me because they are self-harming,
Mhm.
and I think with this problem of drug usage, um, also I find in some of my clients that it's more a cry for help.
Mhm.
There's so much emotional pain,
Mhm.
and they're not being heard, they're not being seen. They are not being accepted. There is no unconditional acceptance given. So it's a cry for help. It's saying, look at me, kind of that kind of thing. And yes, it is, and a lot of children, youngsters do it, again for peer approval. Somebody is doing it, and it's some kind of a ritual that they practice, and they're not knowing how harmful it is, just to be accepted by a certain peer group. So there is also that. But it's also this, being discounted for what you do, lack of recognition for who you are, and all of this that creates this intense emotional pain. And I think, a lot of children use all of these, things to escape that kind of pain.
And how often are we able to cure the problem completely or manage the problem completely? Is it the same thing with normal diseases that we see, that if you come early, then you will be managed better? Is it the same thing, or people have this misconception also that once you start on drugs, for example, medicines for mental health therapy, or CBT, it has to be there for life? So is there any truth in it? I mean, are there cases where we are off therapy in the middle because we are better, we are fine, and we have not relapsed in any way? Is that true? Dr. Parekh, you would be better to answer this.
I mean, absolutely. I mean, this is incorrect to the level that it's very difficult even to respond to this. And it's a very common thing that unfortunately people say. The fact that you can be dependent on therapy is probably the stupidest thing any person can even allow themselves to believe. Right? You choose to go to a psychologist. You choose to go because of what it is giving you. You are having some concerns. In a structured, standardized, non judgmental, scientific manner, a trained expert is giving you a structured treatment. Now, coming to medications, try and understand this. I'll give you a perspective from history to try and understand this. When did the first medicine of psychiatry come into the world? In 50s. That's just about 70, 80 odd years back. Obviously, the first few medications that came in the world were trials. They helped in some way. They had a lot of side effects, sedation, so on and so forth. By 70s, medications became a lot better. 90s was largely seen as the decade when psychiatric medications became so tailor-made. Today, we are in a very different zone where we were, let's say, a few years back. Are all medications sedatives? No, only those medications which are for the purpose of giving sedation. If you need sedation, have sedation, but other medications don't. You can drive with most medications, you can fly, you can go out, you can socialize, you can have a relationship, you can be intimate, you can lead your normal life. That's the idea of medications. It's not taking you away from your life. And yes, different illnesses will have a course of treatment. Certain times you'll give medication for 6 to 8 months, sometimes lesser, sometimes a bit more. There's a course that you follow based on the clinical condition. If you follow your doctor's advice, dependence is not a concern. And most cases, medications will not be given lifelong. Most cases. Does that mean some people will not? Not true. But then let's ask ourselves questions. But what about blood pressure, diabetes, thyroid? I mean, I can just go on and on and on. Just
Where
because
we take medicine for life.
mental
Yeah.
health, that doesn't mean you question a science which is coming from the same school of thought where cardiology came, or where diabetes came and cancer care came. They're all illnesses. I'm sitting in a hospital, and in the next chamber I have a colleague who's a cancer specialist, and on the other side I have a, a urologist, and the next chamber is a skin specialist. We're all medical practitioners doing medical treatments based on our expertise. That's how you look at it. Don't hesitate. Go talk to an expert. Be aware. Be aware of your rights. Be aware of be open to learning as well. But yes, if you see a red flag, and act on it as well. But don't allow yourself to believe that therapy will cause dependence or medication will cause dependence, because both of them are incorrect.
And talking about experts, Chandrika, do you think we have actually overcome the problem of the ratio, number of experts that we need and the number of experts we have? So that again becomes a problem. Then overcrowding becomes a problem. Then overburdening becomes a problem because one expert gets overburdened. So which is one of the reasons why probably that's another reason why people don't go to seek therapy, because probably the wait list is so long. So do you think we have been able to overcome that problem?
Oh, no, no, we are long way, as Dr. Parik has been saying. The statistics speak for themselves, right? There is such a dearth of qualified, trained medical health professionals today. And yes, it is not easy to find a trained professional in this field. I mean, the wait list is so long. And yes, there are so many myths around medication and therapy. And even till today, I mean, we've been listening to Dr. Parekh, who is saying how hesitant people are to seek help. So no, we need there's a lot more work to be done in this field, and we are. I mean, definitely there's a lot of progress, but still a very long way to go.
And Dr. Parikh, how long before you see the demand and supply gap plugging? I mean, do you see it anytime soon? No.
It can't. You have almost a 300% shortage of experts in our country. How can that
Mm.
ever change? What will change
Mm.
is that digital mental health will create an access which
Mm.
will reduce the imbalance between urban metros and let's say tier 3 and rural. That's one part. I feel AI is going to bring a lot of change because it hopefully will add a layer, which I think is very, very important. And I'm all for science and I'm all for change. I'm not going to say that, the human solution is the only solution. I fundamentally believe AI is going to help. And I would want to see solutions where we are able to reach most people. And I also feel that primary health care physicians and primary healthcare providers need to be trained to take care of, let's say, level one of mental health concerns. And I'd like primary healthcare, primary workers, all of them to be able to do some basic work.
And during the start of the conversation, we talked about how most of the experts are concentrated at this urban centers. So, Chandrika, I would like to know, most of the cases you consult, people who come to you, which strata do they belong to? Is it mostly from the urban section of society, or do you get some rural cases as well?
No, it's all urban.
Hmm. It's all
It's all
urban.
urban. Yeah, and mostly, I mean, 80% of my clients are online.
Hmm. Hmm. So,
They,
in a way, we can say probably we're not even aware the kind of problem, or the kind of the magnitude of problem in the rural areas. There, it may be huge. Urban, if we are seeing an explosion of sorts in mental health diseases, so rural could be as much affected. But for all you know, we don't even know what exactly the magnitude is. Is that correct? Would it be right to say that?
human beings are the same, right? We all go through the same challenges, whether we are in a rural area or in an urban area. So,
Hmm.
yeah, so these kind of challenges abound everywhere.
Hmm.
And yes, I'm very, it is but, reasonable to assume that it is equally prevalent in
Hmm.
all parts of the country,
Hmm.
not just in urban areas.
And Dr. Parekh, is this the same kind of problems that you see when it comes to urban centers and rural centers? Is the same kind of problems more or less, or is it like different that you consult?
Clinically, it will be very similar, but
Hmm.
your social impact or the social aspect of the same illness and its interface and presentation may vary at times.
Hmm.
But because of telemental health, rural population has started seeking help for sure. The
Hmm.
percentage of people I was seeing, let's say, pre-COVID and post-COVID, the rural percentage has increased, and
Hmm.
that's a step in the right direction.
Hmm. We're almost towards the end of our conversation, so I just want to sum it all up what we have discussed so far. But one thing that I would like to end with, which I want both of you to comment on, is we have talked about lots of challenges, but if you were to pinpoint one problem, major problem, what is it that you think of, and what are the short-term and long-term solutions, possible solutions that you can think of? If you could, Chandrika, if you could start with that, with you.
I think education is key, especially when it comes to children.
Mhm.
I think we need to put in all efforts to build emotional resilience in our children and in our youth, and we need to bolster them by giving them the right tools, the right skills to empower themselves, right, to so that they can take responsibility for their own emotional well-being, with the kind of skills and tools that we give them and teach them. So I think emotional resilience is something that we really need to work towards, so that any kind of ups and downs and challenges that they face, they are able to cope with it, and not succumb to so much pressure that it's inevitable. So children will have these inevitable challenges that every all children face. So we've got to help them with strategies and skills to be able to cope with all of this.
Mm. And
So I
Dr.
think
Parekh, what would you say?
No, I think we need to focus on help seeking behavior and we need to create access for help. Both those things are important. From primary healthcare to tertiary hospitals, we need to integrate mental health in a structured manner and ensure that there is organized, structured, multidisciplinary mental health support available under one roof, both in physical and in the digital space. And we need to be able to embrace the innovations that mental health will see in years to come. And with our goal of not bringing it down, but with our goal, which is single minded, last person who needs help, however far that individual is, should be getting that help. This year's theme is making mental health a universal right.
Mm.
Universal and right. These two words is what you take, all of you listening. Think about that. Is it universal? Have we made it and made it a priority, which is a right for all of us? That's it. You do that, and the job's done.
Yeah, actually, we're talking mental health and universal health together. That in itself says a lot. We have come a long way. Thank you so much, both of you, for this insightful conversation. I'm sure whoever will listen to this, it's going to be a real eye opener. Thank you so much for being part of this HT Dialogue. Thank you so much, Dr. Parekh, and thank you so much, Chandrika.
thank you for having me.